In this video, I'm going to talk to you about Kegels or pelvic floor contractions. Kegels are a contraction of the pelvic floor. Now, the pelvic floor is a kind of hammock of muscles that sits at the bottom of your pelvis, and it supports your pelvic organs from below, which are also supported from above with ligaments. A Kegel is the coordinated contraction of those muscles up and in. Studies have shown that doing Kegels during pregnancy can help keep your pelvic floor strong and prevent pelvic floor dysfunction. But it's really important to remember that your pelvic floor is part of a core system, what we talked about in What is Your Core? It's shaped like a Coke can with the pelvic floor at the bottom, diaphragm at the top, and all of the abdominal muscles wrapping around. While it is important to be able to contract and relax the pelvic floor, it's also important to be able to coordinate it with the rest of your system. So on the one hand, we want to know how to do a Kegel and how to contract those muscles without contracting our abdominal muscles or bum or thigh muscles. But at the same time, we want to know how to not bear down with the top of the system, so the diaphragm and the upper abs. We'll clarify that in breathing 1, where we'll learn how to breathe into the pelvic floor, feel the muscles stretch and expand, and then recoil back to their original position. Well, here we're going to talk about them going from their original resting position to going up and contracting upwards and inwards. It's really important to be able to do both. Relax, return to normal, contract, return to normal. There are lots and lots and lots of cues for helping you identify exactly what you're doing. Some people talk about picking up a bean or a raisin. A popular one at the moment is sipping up a smoothie with your vagina. And one that's a bit gross, but I've found works really, really well over the years is imagine somebody is pulling your tampon out and you have to keep it in. I know it's really gross, but it really, really works. Okay, so let's practice. It may be easiest to do this lying down. We're going to practice it with the breathing that you learn in breathing 1. So you're going to take a deep breath in, breathing into your abdomen and into your pelvic floor. And then on the out breath, you're going to contract your pelvic floor in and up. So breathing in, feel those muscles expand. And then as you breathe out, pull those muscles in and up. Do that one more time. Breathe into the pelvic floor. Feel those muscles expand and relax. And then as you breathe out, give them a little help and just do a little pelvic floor squeeze. It's not just a squeeze at the front and it's not just a squeeze at the back like you're stopping a fart. It's all of that hammock of muscles. It can be really hard to know if you're doing it correctly. So a couple of ways to know if you are is to put your hand in between your legs. And what you should feel is the muscles pulling away from your hand. If you feel something pushing into your hand, then you're bearing down and that's not a pelvic floor contraction. Another thing you can try that requires a little bit more privacy is just take a finger, pop it up inside you, and you should feel the muscles grab your finger and pull away. If you feel them pushing your finger out, again, that's bearing down. That's not what we're looking for. As I mentioned before, the contraction's important, but the relaxation is just as important. Remember, if you want to have a vaginal birth, you're going to be pushing a baby through that pelvic floor in a few months' time. So you really need to learn how to relax that pelvic floor too. We go through this a lot in breathing 1, where we get into a deep squat and we breathe into your pelvic floor. In general, there are 2 types of contractions that are practiced, either quick contractions, so you want to squeeze, release, squeeze, release, squeeze, release 5 to 10 times, and the longer contractions, which involve squeezing and holding for 5 to 10 seconds, then fully releasing the pelvic floor before doing the next set. You may also want to try this in different positions, so it may be easiest to do this while lying on your back in the beginning. But you also want to try it in a quadruped position, in a side-lying position, and in a seated position. These are all things that you can try on your own, but my biggest recommendation is go and see a really good pelvic floor physio who can help teach you how to contract the pelvic floor muscles and release them. They can also see if you have a weak pelvic floor or a too tight pelvic floor, because if your pelvic floor is too tight, you might not want to do contractions at all. Of course, your pelvic floor could be just perfect in the middle, neither too tight nor too weak. Finally, I want to talk about Kegels and exercise. I know that there are a lot of people that will tell you to squeeze your pelvic floor while you do exercises. There isn't full consensus about this in the pelvic floor world, but I personally don't teach you to do this. Most women simply have to address breathing mechanics, know how to relax and contract their pelvic floor. They need to learn how to exhale through the effort, through the difficult part of the movement, like we learn in breathing 2, and not lift excessive weight. So I won't be teaching you to do a pelvic floor contraction while you're exercising. I think that's over the top and can cause a lot of overactivity for a lot of women. As well as that, if you're trying to breathe and do a pelvic floor contraction, it's kind of like, trying to do this. It gets super duper confusing. So just remember, below before you go, don't use too much weight. And for the vast majority of you, that will be more than adequate to safeguard your pelvic floor.